You've conquered USMLE Step 1 and Step 2. It is now time to pass Step 3. You might feel a mix of excitement and apprehension. Step 3 is a rite of passage. Passing means proving your readiness for independent practice. It's easy to feel overwhelmed by the sheer volume of information this exam encompasses. But remember, you've been building towards this moment throughout your medical education. Now it's about refining your skills and demonstrating your clinical acumen. Step 3 emphasizes patient management over time. It evaluates your ability to manage patients from initial presentation to follow-up care. Imagine yourself in a bustling emergency room or a busy outpatient clinic. You're faced with a patient presenting with a complex set of symptoms. You need to take a thorough history, conduct a focused physical exam, order and interpret appropriate diagnostic tests, and develop a comprehensive treatment plan. This is the essence of what Step 3 assesses: your ability to think critically, solve problems, and make sound clinical judgments in real-time scenarios. Step 3 is a challenging exam, but it's not an insurmountable one. With the right preparation and a strategic approach, you can conquer this final hurdle and achieve your dream of becoming a licensed physician. The key is to approach your preparation systematically, breaking down the vast syllabus into manageable chunks and focusing on high-yield topics. Utilize a combination of resources, including review books, online question banks, and practice exams, to reinforce your understanding and identify areas where you need further review. Remember, you're not alone in this journey. Lean on your support system, your classmates, mentors, friends, and family, for encouragement and guidance. Celebrate your progress no matter how small, and don't be afraid to seek help when you need it. Over the next few sections, we'll delve deeper into the specifics of the USMLE Step 3, providing you with practical tips and strategies to help you prepare effectively and approach the exam with confidence. Imagine standing on the cusp of a grand adventure, having successfully navigated the treacherous terrains of Steps 1 and 2. You've proven your mastery of basic medical sciences, memorized countless anatomical structures, and tackled intricate biochemical pathways. You've honed your diagnostic skills and begun to think like a clinician. Now, as you prepare for Step 3, you're transitioning from textbooks to real-world patient care. Step 3 challenges you to apply that knowledge in practical, patient-centered scenarios. It's about bridging the gap between theoretical concepts and their application at the bedside. Picture yourself as a physician making critical decisions that directly impact a patient's well-being. Step 3 assesses your ability to manage patients over time, considering the evolution of their conditions and potential complications. In Step 1, you might have been tested on the mechanism of action of a particular antihypertensive drug. Step 2 might have asked you to diagnose hypertension based on a patient's blood pressure readings and symptoms. Step 3 takes it a step further. Imagine yourself facing a patient with newly diagnosed hypertension. You need to consider the diagnosis, treatment strategy, patient's age, comorbidities, lifestyle, and preferences. Educate the patient about their condition, discuss potential side effects, and emphasize lifestyle modifications. Anticipate drug interactions, monitor treatment response, and adjust the management plan. This holistic approach is at the heart of Step 3. Step 3 evaluates your ability to navigate the complexities of real-world medical practice, where patients often present with multiple comorbidities and unique needs. It's about understanding that medicine is not always black and white, and that clinical decision-making involves weighing risks and benefits and collaborating with other healthcare professionals. Imagine managing a patient with poorly controlled diabetes and a foot ulcer. You'll need to address the acute issue, the ulcer, while considering the underlying condition and its long-term management. This might involve ordering tests, consulting specialists, and developing a comprehensive treatment plan. Step 3 assesses your ability to prioritize tasks, delegate responsibilities, and communicate effectively with patients, families, and other members of the healthcare team. It challenges you to think on your feet, adapt to changing clinical situations, and make sound judgments under pressure, skills essential for any successful physician. As you prepare for Step 3, remember that you are building upon the foundation laid by Steps 1 and 2. The knowledge you gained in those earlier exams is still relevant, but now it's about integrating that knowledge with clinical reasoning and problem-solving skills. Think of Step 3 as the culmination of your medical education, where you demonstrate your readiness to transition from learner to leader. It's an opportunity to showcase your ability to apply everything you've learned, from basic science concepts to clinical management strategies, in real-world patient care. The exam challenges you to think critically, analyze information effectively, and make sound clinical judgments. Step 3 is not just an exam. It's a simulation of real-life medical practice, designed to assess your preparedness for the responsibilities of being a licensed physician. It's about demonstrating your ability to handle the challenges and rewards of caring for patients, from diagnosing and managing their conditions to providing compassionate and ethical care. Approach your preparation with confidence, knowing that you have the knowledge, skills, and determination to succeed. Step 3, much like its predecessors, is a meticulously structured assessment designed to evaluate your readiness for independent practice. Unlike the single-day marathons of Steps 1 and 2, Step 3 unfolds over 2 days, each with its distinct focus and challenges. Understanding this structure is key to approaching your preparation strategically and maximizing your performance. Day 1 focuses on assessing your knowledge base and clinical decision-making skills through multiple-choice questions. You'll be tested on a broad range of topics, requiring you to recall facts, apply concepts, and interpret clinical data. Day 2 takes you into the heart of clinical practice with clinical case simulations. You'll interact with virtual patients, order tests, interpret results, and make treatment decisions in real time. This immersive experience evaluates your ability to handle the dynamic nature of patient care, requiring critical thinking and adaptability. Imagine Day 1 as laying the groundwork for your success as an independent physician. It's about demonstrating your command of medical knowledge and your ability to apply that knowledge to solve clinical problems. The day consists of 6 blocks of multiple-choice questions, each lasting 60 minutes, with a total of 45 minutes allotted for breaks. This translates to a mentally demanding 7 hours of testing time, requiring stamina, focus, and effective time management. The questions cover a wide spectrum of medical disciplines, including internal medicine, surgery, pediatrics, obstetrics and gynecology, psychiatry, and more. You'll encounter questions testing your knowledge of disease processes, diagnostic criteria, treatment algorithms, and pharmacological principles. Unlike the recall-heavy questions of Step 1, the emphasis here is on applying your knowledge to diagnose and manage patients. For instance, instead of simply recalling the symptoms of pneumonia, you might be presented with a patient vignette describing a cough, fever, and shortness of breath. The question might ask you to interpret a chest X-ray, identify the most likely causative organism, and select the most appropriate antibiotic therapy. This integrated approach to testing requires you to think critically, analyze information from various sources, and make sound clinical judgments. Day 2 of Step 3 transports you from multiple-choice questions to the clinical case simulations, or CCS. This part simulates real medical practice, challenging you to manage patients in a virtual environment. The CCS portion consists of 13 simulated patient cases, each lasting about 10 minutes, with 45 minutes for breaks. You'll get a brief patient history, vital signs, and initial findings. You'll interact with the patient, order tests, interpret results, make diagnoses, prescribe medications, and counsel on lifestyle modifications. You can advance the clock to observe the patient's response to treatment. Imagine managing a patient with poorly controlled diabetes and a foot ulcer. Take a history, perform a physical exam, order tests like blood glucose levels, wound cultures, and imaging studies, and make treatment decisions. This might involve prescribing antibiotics, debriding the wound, providing wound care instructions, adjusting diabetes medications, and counseling on foot care and glucose monitoring. And mastering the multiple-choice questions on Step 3 requires a strategic approach that goes beyond mere memorization. Develop your clinical reasoning skills and apply your knowledge to solve complex clinical problems. Approach each question systematically. Carefully read the question stem, identify key information, and the specific task. Analyze the answer choices, eliminating those that are clearly incorrect. Use your knowledge and clinical reasoning to deduce the most likely answer. Focus on understanding the why behind the what. Understand mechanisms of action, spectrums of activity, and potential side effects. This deeper understanding will help you select the most appropriate antibiotic for a given clinical scenario. The clinical case simulations are the most unique and challenging aspect of the USMLE Step 3 exam. They require you to think on your feet, prioritize tasks, and make critical decisions in a fast-paced, simulated environment. Success hinges on managing your time effectively, utilizing resources strategically, and applying clinical judgment in a realistic context. Use all available tools wisely, including ordering tests, consulting specialists, and advancing the clock to observe treatment responses. It's natural to encounter areas where you feel less confident. View these knowledge gaps as opportunities for focused review and reinforcement. Use practice questions and simulated cases to identify strengths and weaknesses. Develop a deep understanding of core concepts and principles, not just memorize facts. Embarking on your Step 3 preparation journey can feel overwhelming. Your study plan is your roadmap to success, guiding you through the vast sea of information. Assess your current knowledge base and identify areas that require focused attention. Allocate your study time accordingly, focusing on high-yield topics and areas where you feel less confident. Create a realistic study schedule that integrates with your existing commitments. Maintain a healthy work-life balance throughout your preparation journey. Your success on Step 3 hinges on selecting the right study resources. Choose a comprehensive review book that covers all major topics tested on Step 3. Explore online resources like interactive question banks to test your knowledge and track your progress. Consistent and deliberate practice is key to mastering Step 3. Make practice questions a constant companion, integrating them into your daily study routine. Focus on understanding the reasoning behind each answer choice and identifying patterns in your mistakes. Managing your time effectively is crucial for covering the vast syllabus and honing your clinical skills. Create a realistic study schedule that aligns with your obligations and allows for regular breaks. Utilize time management techniques like the Pomodoro technique to maximize productivity. Maintaining focus and motivation can be challenging, but your mindset plays a crucial role. Set realistic goals and celebrate your achievements. Mistakes are valuable opportunities for growth and improvement. Review your performance after each practice test or simulated case. Identify patterns in your mistakes and focus your study efforts on those areas. Develop a deep understanding of underlying concepts. Exam day is here. Approach it as a seasoned conductor approaching a grand symphony. Stay calm, focused, and organized. Trust your training and approach the exam with confidence. Pace yourself strategically and maintain composure even with challenging questions. The hours leading up to the exam can significantly impact your performance. Engage in activities that help you relax and de-stress. Stick to your regular routine and eat a nutritious breakfast. Gather all necessary documents and plan your route to the exam center. Familiarize yourself with the exam interface beforehand to avoid stress on exam day. Practice navigating the interface using the free downloadable exam software. Arrive early to complete check-in and adjust your chair for comfort. Time management is paramount during the multiple-choice question sections. Calculate your average time per question and pace yourself strategically. This approach ensures you attempt all questions within the allotted time. Sustaining your focus and energy requires attention to your physical needs. Pack healthy snacks and beverages to enjoy during breaks. A well-prepared mind and body are key to success on exam day. As you reach the final moments of the USMLE Step 3 exam, a sense of accomplishment washes over you. The computer screen fades to black, signaling the culmination of years of relentless dedication. You've traversed the intricate pathways of medical knowledge, navigated the complexities of clinical reasoning, and honed your skills as a future physician. Take a moment to acknowledge the magnitude of your journey. You've not only conquered a grueling exam, but you've also proven to yourself that you possess the intellect, resilience, and compassion required to excel in medicine. As you embark on the next chapter of your medical career, carry with you the knowledge, skills, and values you've cultivated. Remember the importance of lifelong learning and approaching each patient with empathy. The road ahead will present new challenges, but you are equipped to navigate them successfully. Trust in your training, embrace the unknown with courage, and value human connection in healing. Medicine is both a science and an art. Treat each patient with dignity and respect, and listen attentively to their concerns. It is in these moments of genuine human connection that the true essence of medicine shines through. As you step forward with confidence and compassion, remember you are part of a vibrant community united by a passion for healing.